Hello, and welcome to the webinar Listening to Survivors. I'm Christina Presenti from the National Sexual Violence Resource Center, and I'm really happy that you clicked on this webinar in particular. This webinar is focused on how SARTs can incorporate survivor voices and feedback into their work. This is one of many webinars you'll find in the SART Toolkit and in the SART webinar series. We would like to thank the Office for Victims of Crime for their support and funding for this webinar and the entire SART Toolkit. We would also like to offer the disclaimer that the opinions, findings, and conclusions or recommendations expressed in this webinar are those of the contributors and do not necessarily represent the official position or policies of the United States Department of Justice. I'm really excited to introduce you to your presenters today, and I'm so happy that you could all be here with us to share your expertise and how to listen to survivors. And I will turn it over to you. Thank you.
Thank you, Christina. This is Denise Eng. I am a senior advisor with Praxis International in St. Paul, Minnesota. I've been with Praxis for about 10 years, working primarily in our institutional analysis and blueprint for safety programs. The work here at Praxis is focused primarily on learning how to reform systems so that they respond more effectively to the needs of survivors of violence. My background before I came to Praxis was in advocacy for a number of years, and so that's kind of the perspective that I always try to infuse into the work that I do.
Hi, everybody. I'm Maren Woods, Program Director at Praxis International, and I'm also here in the St. Paul office, and I work closely with Denise on many projects here at Praxis. I started in this work as an on-call volunteer advocate in Duluth, Minnesota, and quickly connected with Ellen Pence, who is the founding director of Praxis International, and began working with Praxis back in 2000. And I focused my work here at Praxis since then in supporting rural communities to organize an end to violence against women and to work with communities who are working on institutional reform efforts to improve outcomes in cases involving violence against women. And I'm happy to be here today with all of you.
And my name is Jo Johnson. I'm your third presenter today. I'll be opening this session, and I'm a visiting fellow with the Office for Victims of Crime, Department of Justice. I'm entering my third year in that fellowship, and so honored to be able to assist in improving the nation's response to sexual assault. I'm also a licensed clinical social worker. I teach graduate school at George Mason University, and I've worked directly with kids and families for decades. So I'm so glad to be opening this presentation, and let's just get started. The focus of today's presentation will hit three major points: defining listening forums, outlining the benefits of these conversations, and then I'll turn it over to the Praxis International folks to talk to you about effective strategies for preparing and facilitating a focus group with survivors, as this is one type of listening forum and the one that so many of us will use. So let's define listening forums first. What do we mean when we say that word? Well, listening forums are simply small group interviews that allow professionals to listen to and learn from the communities they serve. You've probably done them, or you may have heard of them, and they may have been called other things like listening circles, community conversations, or focus groups. There's a lot of benefits to doing this group, so let's start there. Listening forums can absolutely accomplish a lot by gathering information. They can help us understand how people describe sexual assault in their communities, how they view this in intimate partner relationships among teenagers, different groups of folks. They can help us understand how people respond to sexual assault, who comes forward to seek services and who does not. And they can give us insights into effective strategies according to the cultures and faith communities that guide their beliefs about how do we heal and how do we get help. If done well, listening forums also have the potential to build relationships between communities and professionals and between other professionals as well. We can use these kinds of listening forums to empower survivors and how important that is to do as so many people are coming forward and talking about sexual violence. It can be an opportunity for these folks to be heard and validated, and to begin to provide and to begin to consider ways that they can continue to be involved so that they reduce violence and provide the next survivor with a better response. We can connect with diverse communities, educate community members about sexual violence, create ongoing communication, identify professionals, community members, and civic and faith leaders. These kinds of folks who can be able to then go on to continue to identify survivors, to connect them with services, and provide ongoing support. We can also use these listening forums as a time to gather information that will help us design prevention and intervention efforts, because people will tell us how to work in their communities if we sit down with them and listen. I want to give you one example of how this worked out, because I really believe in this listening forum process. In one of my most challenging situations, I ended up having a listening forum with the Muslim community. We'd been hearing about sexual assault of teen girls in that community. We weren't seeing many teenagers coming forward for services. We certainly weren't seeing Muslim teenagers coming forward for help. And yet school counselors and teachers and others were telling us, oh, Joe, what can we do to help these teenagers? So I spoke with the imam at one of our largest mosques, and he was hosting a workshop on domestic violence and invited me in. And in the middle of it, when we're seated down with 300 adults from that community, the imam opened up this subject of teen dating violence. It's incredibly difficult to talk about this subject because in the Muslim faith, dating is prohibited. So to talk about sexual assault of teenagers was just a potentially explosive conversation. The imam helped and guided that conversation, facilitated that beautifully, brought me in to provide some information, and then he and I were able to talk with the community throughout the day about what was going on, what different people were hearing and experiencing, and what he as the imam was hearing as the faith leader in his community, and to at least begin that next step of, and how do we address this violence and protect our children. So as you set out to do listening forums in your community, consider the 3 different types of groups you may want to invite. You might start listening forums with professionals. So you're talking to people about the folks that they're serving. You're talking to them about needs and strengths in their responses. And there's some really good guidance on this in listening to communities through the Sexual Assault Demonstration Initiative that's online. You might have different professionals meeting and inviting them into the same listening forum so that they can begin to hear about different groups of people that they serve. One problem in sexual assault is that some people report so the police may know that group, and one group may seek services, and so the hotline or the rape crisis center may know those folks. Other people who have been assaulted may only talk to school counselors, to college staff, to military systems, right? They may not even come forward into the more sexual assault services. So by getting these professionals together, by helping them talk about who are you seeing, what's going on, you can get such a great sense of what's happening for diverse communities in your area. You might also want to talk to community members. That's a little bit more challenging of a conversation for some. I love it and do it all the time when I start new programs. I've seen it done in a beautiful way by the military. The Sexual Assault Prevention and Response Office organized a series of focus groups for all members of the military community, different levels of officers, different branches of services, and they sat down with people, not necessarily survivors, but they sat down with people to say, what's happening here? Can you tell us about? Right? Can you tell us how to help fix the problem and intervene well? And then the military continued to use that focus group structure to go back to that group to then say, well, this is how we've started to intervene in this issue to reduce sexual violence. How are we doing? Who's being served and who's not? Are we helping female and male survivors? Right? And they've created that ongoing feedback loop that's really possible to do with community members. And most importantly, and most often, you can gather groups of survivors together. And I'll let Praxis address that group as they move into their section. So you get a lot more detail as they begin. Now, I'm sure that many of you have that whole, but what about, I don't have enough time, I don't have enough funding to do this, I don't even know how. Well, if a listening forum or a focus group process is new to you, get some help and mentoring. There's some great organizations out there to help you. I started it when I had to develop services with Girls Incorporated. I tried to take these great materials from this organization and build an outreach program for adolescent girls. And I couldn't make it work. I was an experienced social worker. I couldn't make this fly. And if we could get groups of girls together, it often fell apart. It wasn't until I just said, stop this. Let's take some time to listen to our community. When the small staff and I went out and we listened to everyone. We sat down on front lawns with community residents. We went to schools and we talked to small groups of students. We listened to a lot of different voices, even the teachers, the counselors, even the janitors could tell us something about what was happening for teenagers. So by listening, we were able to engage them and ask them, how do we start this program and how do we build it? And they would tell us. I found that also really helpful as I began to work with domestic violence and sexual assault issues and concerns. And it was there that I went back for more mentoring on how to do this safely and effectively. You can also use listening forums to accomplish a lot of goals. So it's well worth your time and can mean the difference between does your program work or doesn't it? And why is it particularly important to do now? The Me Too movement has sparked a public speaking out by survivors across all kinds of communities and ages and genders and industries like we've never seen before. You can't hardly go on the local news anymore and not hear about people who are bravely speaking out about violence that they've experienced. And now's the time to engage their outrage, to listen to their experiences, and build partnerships to create change. So this is a great point to turn this over to the Praxis folks who can guide you in terms of preparing for and facilitating these important conversations. They've been my teachers, and they've done a great job, and I've always appreciated their guidance in this work. So, Denise and Maren, are you on?
Yes, thanks so much, Jo, and thank you for all of that storytelling. And it's so important to give those kinds of concrete examples for how conducting listening forums, reaching out to hear from survivors and people in your community is to shape our programming, shape our institutional reform efforts. So I want to just start out with a little bit of foundation for who Praxis International is. We're a nonprofit organization that's working to eliminate violence in the lives of women and children. And we were formed originally in 1996 to provide tools and resources to activists and advocates who are engaging in system reform efforts. using a particular methodology that our founding director, Ellen Pence, developed. The methodology is now broadly referred to as institutional analysis, but is also referred to as community assessment, best practice assessment, and originally the safety and accountability audit. A central feature of Praxis institutional analysis is using listening forums, or what we have typically referred to as focus groups, to learn from survivors about what does and doesn't work with institutional responses to violence against women. And as Joe said, there's many terms that people use for this process. A couple others that come to mind are community consultations or talking circles. I want to be really clear on this front end that what we're describing is not a support group. This isn't an opportunity for survivors to get together and support each other related to their mutual experiences about violence, but instead what we're describing here for the rest of the webinar are focus groups or listening forums but with a shared experience that a group might have, but it's really focused on what how the institution has responded or how the communities have responded to the violence survivors have experienced. And so I just wanted to be sure about that distinction for our audience. But throughout the remainder of this webinar, we will tend to use, you'll hear Denise and I tend to use the term focus group, but really all of these, you can call them many different things. So Denise and I have worked with many, many communities in our years of working together to guide them in using Praxis institutional analysis to inform their system reform efforts, including guiding them really specifically on how to organize and facilitate focus groups. Both Denise and I have also conducted many focus groups ourselves, and so we're really happy to share with you today what we know and what we've experienced in conducting focus groups to learn from survivors. What is a focus group? Joe, you described this part well about defining what the groups are. I wanted to say just a couple of other things about the purpose and also sort of generally speaking the shared experience piece. The focus group does usually tend to focus on a specific topic that is organized and planned and thought in advance to contribute to broader systems change work. And we gather survivors together to learn about the collective experiences that they've had in relation to being a survivor of sexual assault. And typically they have shared experiences with various system interventions or things in the community or the media, and bringing the survivors together in this way really helps to get a broader sense of what survivors mutually have experienced. But they are also an opportunity to hear from those who might not be represented in official statistics, particularly those that are underrepresented or underserved communities. And I also wanted to distinguish focus groups in these various contexts between market research and institutional analysis focus groups. Focus groups are used in a variety of ways beyond violence against women work. For example, market researchers often use focus groups in product development or marketing. Many people are familiar with this type of practice, but it's not to be confused with the focus groups with survivors that we're talking about here today. Market research focus groups differ from sociological focus groups in some really particular ways. Market research focus groups tend to be highly structured. They use pre-established questions that focus on feedback on products, campaigns, or platforms. And typically, they are seeking quantifiable responses to help them make marketing decisions about their products. But when Praxis refers to focus groups with survivors, and what we're talking about here today in the context of developing SARTs, is that we want to gather groups of survivors together to hear about general topics. We roughly follow a predetermined outline, but aren't rigid in sticking to that outline. We encourage interaction among the group's participants. And again, we focus on people's experiences with, their reactions to, the impact of, and perspective of interventions or institutions that have addressed the violence in their lives. Focus groups, as we talk about them and teach them, tend to resonate across cultures that might be in your community, as it provides opportunities for storytelling, creates opportunities for sharing collective experiences, and for sharing experiences with intersecting social problems. And there's many specific additional strategies that we'll get into later in this webinar about how to attend to culture, but this is sort of the broad distinctions between some overly rigid market research focus groups and what we're talking about here today. One other piece that's really important is that in focus groups within the context of institutional analysis or system reform work is that we encourage survivors to share what matters the most to them about their experiences with systems rather than what matters to us as facilitators. We might have some ideas about what victims have been experiencing with systems, but really we encourage the participants of the focus groups themselves to identify what matters the most and what's had the biggest impact on their lives. And so through that process, then, there's a development of awareness and knowledge of other people's experiences. So focus groups can be quite transformative and impactful to both participants of the group and for intervening systems. Focus groups can be transformative for participants or survivors by helping them connect with others who've had similar experiences. The realization that the same things have happened to others reduces the sense of isolation that often comes with having experienced sexual violence. Many participants are grateful to have the opportunity to turn what has happened to them into something good for someone else and to contribute to changing problematic practices in intervening systems. For some participants, the opportunity to tell part of their story can help with the healing process, to work for justice, improve responses, and identify or help develop new resources. For systems and practitioners, focus groups can be helpful in helping them to transform their response by providing insights that they can't gain in other places. They get to hear directly from survivors. And through focus groups, too, they can illuminate what is working from the standpoint of victims and what's not working. And this kind of information from survivors can really lead to lasting institutional change. So now I'm going to hand this over to my coworker, Denise, who's going to help us get through some of the nuts and bolts of preparing for facilitating effective focus groups.
Thanks, Maren. Effective listening forums, which, as Maren said, Praxis tends to refer to as focus groups, do require a fair amount of planning and thoughtful and careful attention to how to conduct and execute the group. The information that is gleaned from these groups can be very powerful in its impact and very meaningful for focus group participants. It is a worthwhile endeavor, but also very important to give plenty of attention to the planning and the conducting of the group. I'm going to give a quick overview and then dive more deeply into each aspect of planning and development of the group. So first, I want to talk about who's involved with planning and putting together a focus group. I'll talk in more detail about each of these aspects in a moment, but I just want to provide a brief summary of each person's role and responsibility at the outset. First, focus groups require someone to be in charge of planning. Usually this will be someone in a community-based advocacy program, or a SART coordinator would be a likely person to be conducting a focus group or planning for a focus group in this context. This person will be responsible for recruitment of focus group participants, determining the location, identifying and addressing any safety concerns, deciding how much time will be required, and handling the financial detail of conducting the group. The planner must work with partners to decide the topic or topics to be explored, who the target audience is, how much time will be needed, and so on. The planner will help decide on facilitation, note-taking, or documenting the group conversation, who, if anyone, will observe, and ensuring that an advocate is present at all times. The facilitator of the group should be someone who has experience in group facilitation and has an empathetic approach to talking with survivors. It doesn't need to necessarily be someone with any special training, as long as it is someone who is accustomed to group facilitation and skillful at that, and who can talk to survivors in an empathetic and caring way. The facilitator will help establish ground rules for the group, prepare participants for what will happen during and after the group, and will guide the conversation. She or he will also ensure that appropriate care is given to participants throughout the group session. The planner and facilitator will also work together to determine how the group conversation is to be documented. Most often this will be done with a note taker, though occasionally it's appropriate to record the session. It's always necessary to obtain informed consent from focus group participants, but it's especially important if you want to record the conversation. If anyone objects to recording, it should not be done. It can be helpful for note takers to be prepared to capture exact quotes because those quotes can be extremely powerful, but it's also really important to protect people's anonymity when doing so. Advocacy involvement is really, really critical in these conversations. Though the intent of the group is not to ask participants about their experiences of sexual assault, it often comes up naturally in the conversation and can trigger difficult emotional responses. So for these reasons, it's important to have an advocate participate in the planning and to be present before the group happens, during the group, and then after the group to offer ongoing support and help. And then finally, sometimes you might want to offer system practitioners the opportunity to observe the group. Many practitioners report that this experience is transformative to them. They often hear things they would not have heard any other place or not previously considered. If you're considering involving system practitioners, we have to keep it in mind during recruitment as well, and we'll talk more on this a little bit later. So what are we talking about in focus groups? The focus of the discussion is not to talk about the individual participants' experience with violence. We're talking about the system's response. We're trying to understand what the system or institution did or did not do once they learned that someone had been sexually assaulted, not what did the survivor do in response to being harmed. So what we're trying to do is to uncover that information and then use it to create improved responses to sexual assault. And so the discussion as such will focus on the response of intervening systems. So facilitators might ask questions like, what actions by practitioners contributed to or interfered with safety, well-being, and justice? What worked well for the survivor and what did not work very well? What did survivors want compared to what they actually received? That is to say, what gaps in the system's response did they experience? One example of this is that I've heard survivors say many times something like, I just wanted someone to listen to me. I wanted someone to talk to me like what happened to me mattered to them. It's not actually an uncommon thing to hear from survivors in groups like this because oftentimes system practitioners come with their tasks in front of them that they need to do to accomplish the duties in their job descriptions. And so they can come off to the survivor as being not very compassionate, as though it doesn't matter to them what happened. And so that's a very common thing that we hear. And so oftentimes what we hear from survivors is that how they're treated in the interaction with the system person has a much bigger impact regardless of the outcome of the case. And one example of this is from a retired police officer I know who distills what he learned from survivors in this area as, hear me, believe me, and try. In other words, what survivors said to him when he was involved in this kind of interagency work was that they knew he couldn't guarantee an outcome, but it meant a great deal to them that he did those three things. Hear me, believe me, and try. And so we can learn those things from survivors and communicate that back to practitioners in our SART teams to help build a more effective response. We want to talk about safety and well-being here because this is a really foundational principle in doing this kind of work with survivors. As Maren has described, in contrast to market research, focus groups with survivors are designed specifically from planning through facilitation and beyond to attend to the safety and well-being. In order to do this, we want to be sure to involve advocates in the planning at every stage. As those closest to the experience of survivors and those who generally provide support and advocacy throughout the lives of the survivors, it's really important that that perspective be infused into every stage of the planning and conducting of your focus group. Everyone involved in the planning, development, and conducting of the focus group needs to be guided by empathy, compassion, understanding, and attention to the emotional impact of survivors' experiences of sexual assault. So who do we want to hear from and how do we find them? How do we recruit people for the group? This can be kind of tricky. You'll want to use language that encourages participation but doesn't trick people by masking the nature of the group. A survivor might not necessarily want to pick up a flyer or write down a phone number that advertises a group for survivors of sexual assault, and of course it's necessary to respect people's privacy in that regard. So you want to think about how you can advertise and recruit in ways that aren't intimidating or off-putting, but also are likely to pique the interest of the people you want to hear from. So sometimes organizers will develop flyers that say things like, we want a group for about women's sexuality or women's health and wellness. Often that kind of caption will resonate with survivors of sexual assault. And then you might want to add a screening step once people begin to respond to your advertising so that you're ensuring that the people who respond have the information that you're looking for. Sometimes planners or organizers know people that they have served in a community-based sexual assault program. There might be people, for example, in the victim witness unit in the prosecutor's office or police department who know people who might have important information to contribute, which is a perfectly appropriate way to do targeted recruitment of participants. When soliciting with that kind of participation, though, it's really important when the survivor is known to the organizers to consider whether it's safe to call or email or send a letter. I mean, I know already advocacy-based organizations are accustomed to considering those in these cases, but this is another place where it's really important to do that. We want to consider privacy and safety when selecting a space. For example, it might be okay to use a public space, such as a library or a community center, if a private room is available. It's often best to avoid locations that are closely identified with the criminal legal system or other institution that survivors may have had negative experiences with, or really even about whom you might be seeking information. We want to consider whether confidentiality could be compromised if someone sees a survivor entering a particular building. For example, a police department or a building that's closely associated with service delivery. We want to ensure consistent advocacy presence. Not only should advocates be integrally involved in all aspects of planning, it's very important that organizers ensure advocates are present to welcome people to the group, to help put them at ease, to remain present during the group and be prepared to help someone step outside in the event the group conversation triggers an intense emotional response for a participant, and then be available to talk and debrief afterwards. It's really important to check in with participants after the focus group. Those who have agreed to come are doing us a great service by sharing really important, vital information that we can't get from anyone else. So it's very important to treat that contribution with the seriousness and the significance that it deserves. So we want to ensure that we're checking back with people to keep them up to date on the ways in which their contributions helped, and to offer information about other opportunities to become involved in system change efforts if they're interested. And sometimes when group participants share problematic experiences with agencies or systems in the community, advocacy issues are raised that should be followed up on after the group. So many important reasons for having the presence of advocates. Securing informed consent is absolutely necessary. We want to start with screening potential focus group participants, but be sure to talk not just about the purpose of the group, but also risks and benefits of participation. Many survivors look forward to the opportunity to contribute to improved system response, but at the same time, if the experience is too emotionally difficult, or if a survivor has an ongoing case and is concerned that talking about that experience with the implicated agencies could harm their case, or there might be other considerations that could create potential risks. For example, if a mandated reporter, it might be present in the room, and the survivor could disclose something that would trigger a mandatory reporting response. We want to be sure to talk about all those possibilities with potential participants. And then finally, we want to emphasize that the entire group is voluntary. Participants can leave at any time if they choose. We want to prepare a confidentiality and consent agreement for participants to sign before the group begins. We want to make sure participants understand that no identifying information will be used outside the group, that summaries will be prepared, that it's possible that quotes might be used, but only if they can't be attributed to an individual, and so on. We want to use first names only in the group and tell participants they can use a pseudonym if they prefer. Note takers should use initials, pseudonyms, or other ways of masking people's identity. I want to make just a few more comments about recruitment. People often ask me how many participants to plan for. 3 to 5 people is ideal, though I've conducted groups of as many as 8. It's not uncommon for 1 or 2 people who say they're going to come to not show up in the end, so keep this possibility in mind during your planning. If you have a significant number of people who want to participate, consider conducting more than one group. In one community where I conducted focus groups, there was a powerhouse of an advocate who was having trouble finding people through traditional methods. So she actually went out to the bus stop and started talking with women at the bus stop and found survivors who had diverse and varied experiences. It ended up being kind of a large group, but it was still very instructive to the project we were involved in. The target group for recruitment will depend on your community demographics and the issue or issues you're exploring. Be sure to use broad strategies to recruit diverse representation. Be sensitive to and aware of the fact that no individual person can represent their entire community, whether it's their neighborhood, their race, gender, sexual orientation, socioeconomic status, etc. To help you recruit diverse representation, rely on your natural helpers or recognize community leaders from the community or communities you want to learn from. Lean on community-based advocacy programs that are well connected throughout your community. Don't just rely on programs that serve victims of sexual violence. Try to think broadly about where survivors might gather, such as medical settings, hair salons, gyms, child care centers, churches, synagogues, or other places where people of faith gather, courtroom waiting areas, shelters, drop-in centers, a lot of different locations around your communities where survivors might show up. When considering the target populations for recruitment, consider how you might reach out to those who've used the system, those who avoid the system, those who've accessed advocacy, and those who have not. Consider conducting separate culturally specific focus groups in your community facilitated by people from those communities, such as immigrant and LEP people, limited English proficiency people. People with disabilities, LGBTQ people, people of color, Native people, those who are homeless and living in poverty. And as I said earlier, it's really important to add a screening step to recruitment to make sure the people you invite to the group will be able to contribute to the body of knowledge you're seeking. I would not put the details of the location, date, and time on the recruitment materials. Once you've conducted a telephone screen and determined that the person's appropriate for the group, you can provide that information. This is also a good time to talk with the potential participant about mandatory reporting, especially if the person discloses any information over the phone that suggests a mandatory report could be triggered. Be sure potential group participants understand that if they disclose information in the group that falls under your state mandatory reporting laws, that any mandatory reporter in the room would be required to make that report. We've said a little about location already, so I won't belabor it, but I wanted to add a few practical points. First, your group will be more successful if you plan to hold it in a space that feels welcoming and safe to participants. Convenience, safety, security, and comfort are really important criteria. One strategy is to piggyback on another existing event or meeting, such as a support group or parenting group or already established group where survivors might be gathered. Consider scouting out locations where survivors might go on a daily or weekly basis, such as some of the other places I've already mentioned, like community health centers, community centers, culturally specific programs, etc. These locations also have the benefit of being fairly anonymous. Survivors can go into the building for the group without raising any questions about their presence should someone see them entering. Pay attention to logistical considerations that can make it easy or hard for people to come. Make sure the location is easily accessible by walking or public transportation if that's available in your town. Make sure the location is physically accessible to those who might need to use ramps, etc. And parking should be readily available and free or paid for by the group organizers. And again, the importance of adequate, comfortable, welcoming space cannot be overstated. Recruitment for the group can actually take several weeks, so don't be discouraged if it takes time. You might have to try a couple of times in order to find enough people for the group. For the actual event, you want to plan for about 4 hours for the facilitators, note takers, observers, advocates, and anyone who's involved in the organizing of the group. Participants should plan to be there for 2 to 2.5 hours. The planners and the facilitators will show up early to set up and be prepared to check in with participants. And then the participants will want to have some time to kind of go over the consent forms and be reminded of the purpose of the group, and then make sure that we're having informed consent before it actually happens. The group itself will generally run for 1.5 to 2 hours. Sometimes participants will linger to connect with the advocate or with one another and debrief the group, and of course the organizers will need some time after the group to debrief and clean up. People often ask me what it costs to conduct a focus group. It's not a terribly expensive activity, but there are some costs associated with this group. I prefer using a facilitator who's connected to the project, in this case to your SART team, who would probably be conducting the group on work time, which would eliminate the cost of paying a facilitator, though if necessary you could pay someone to do this who's an experienced group facilitator. More importantly, however, it's necessary to compensate the group participants for their time. Survivors who agree to participate in this group provide invaluable information to help you improve your system's response that you really can't get anywhere else. We like to think of their information as expert consultation to your SART team. As such, participants should be compensated for their time like anyone else who's coming to the SART team would be. If issuing cash or checks is a challenge for your program, you could consider compensating participants with gift cards. The amount of compensation will vary based on the resources of the program, but it should be sufficient to also cover the participants' travel costs and child care unless the organizers are providing those separately. If you provide on-site child care, you may need to pay the providers if you don't have good volunteers. If you're not providing direct transportation to the group, be sure that their compensation is sufficient to cover bus fare or cab fare. And finally, know your participant pool and be prepared for language access for those who are LEP or those who are deaf or hard of hearing. You may need to hire an interpreter to come in for the group. If the group uses printed materials, be sure they're translated in advance and available for those who need them. And it always helps to provide food for both the group participants and any children who accompany them. Now I want to talk just for a few moments about the group experience itself. Always talk with participants in advance of the group, but be sure to take time either before the group starts or at the beginning of the group to make sure everyone has a full understanding of what the group is about and has an opportunity to ask questions. I like to have an actual consent form that participants will sign that describes why the group is being convened and how the information will be recorded and used. The consent form is a good place to ensure that group participants understand both the protections and the limits of confidentiality. In general, specific information about survivors will not be disclosed outside the group. However, again, there is the question of whether a mandatory reporter might be present. We want to make sure participants know this and understand that if something is said that triggers a mandatory report, confidentiality would not apply to that disclosure. Open by grounding the group in its purpose. Reiterate that the purpose of the group is to focus on the experiences of participants with intervening agencies, systems, and institutions, not their individual experiences with violence. Reassure group members that they are free to talk about these experiences if they choose and believe it's relevant, but that's not the focus. Tell participants that if at any time the conversation becomes difficult for them and they want to leave the room, they're free to do so, and the advocate is available to meet with them. The facilitator should be prepared with some broad categories for discussion and some opening questions. As Maren talked about earlier, this is in contrast to like a marketing research group where you probably develop some very specific questions. We do want to have questions prepared, but they're more likely to be broad categories of questions. Listen carefully to what participants are saying. Feedback to make sure that the survivor statements are understood and recorded accurately. Be prepared to ask follow-up and probing questions. Encourage survivors to talk to each other in the group. Make sure everybody gets an opportunity to speak. Seasoned facilitators know that this can be challenging. I like to tell people in advance that this is part of my responsibility as group facilitator and that I might need to gently interrupt someone and move the conversation along. It doesn't mean I'm not interested, but I want to make sure we hear from everybody. At the same time, reassure participants that it's okay to pass if they don't have anything to add or if the conversation has become difficult and they don't wish to share. When deciding who should facilitate the group, consider asking community members, advocates, others who have experience in group facilitation. It can be helpful to ask someone who reflects and or has the respect of the community participants are from. On the other hand, consider whether some participants might be more likely to be open with someone outside their group, especially if they are from a very small community. Always talk with the group about what's being done to create a record of the meeting. Most often, this will be done on a laptop or pen and paper. Be sure to select somebody who's very good at capturing good notes, or you might want to add a second note taker to provide a better chance of capturing everything. If you prefer, you can record the meeting with the consent of the group, but again, if anyone objects, do not record. Recording is obviously helpful in ensuring you capture everything that's said, but of course, then it has to be transcribed later, so you need to be prepared to do that. If you're using a note taker, prepare them to listen for quotes that can be useful later. Direct quotes from survivors can be very powerful and can articulate system gaps with great impact. Be careful, however, when communicating the results of the group that quotes are not attributed or identifiable as coming from a specific person. Maren's going to talk more about sharing the information, but here I just want to make a couple of points about the note taker's responsibility. Whoever fills this role should be prepared to put together a summary of the group to share with your team. It's best not to share people's raw notes, but to pay attention to gaps and themes that emerge from the discussion. Do not distribute the notes widely. Use the information only for the purpose of analysis and recommendation for change. So who should be a note taker is someone who is a good listener, skillful at capturing the essence of the conversation. This is often a really good job for interns if you have them. Advocates and community members can also fulfill that role. Most often there will not be outside observers, but if used strategically, this can be a very helpful tool. It can be tempting to include your entire SART team, but that might be overwhelming to participants, and so it's usually best to limit observers to 1 or 2 people. It can also be problematic if a practitioner observing the group is known to a participant, especially if it was someone who was involved in their case. I'm not suggesting that you would never let that happen, but for sure you'd want to talk with potential group participants about that possibility from the beginning. Some survivors might actually want the opportunity to let system practitioners hear what they have to say, even if it's someone that they know. Others can be very uncomfortable and would not want to. As always, give as much information as possible in advance and support the decision of the survivor about whether to participate. And I would always say that if a conflict comes up at the last minute, the observer should be gently asked to leave the room because the survivor's experience is the most important and should take priority. The opportunity to hear directly from people who've been on the receiving end of system intervention can be transformative to a practitioner. It's qualitatively quite different from reading a police report or a hospital record or preparing someone for trial. Hearing experiences of a group of survivors, hearing more of their stories than what the practitioner generally hears in police report or courts, etc., can be very powerful. It can also help to hear from observers when debriefing. The facilitator and the note taker are going to be very intensely involved with the group, and an outside person may tune into group dynamics or might pick up on something that they saw or observed that others missed. Most often, system practitioners would be the people who are interested in sitting in on the group. Sometimes advocates or interested members of your community who are involved with your SART might also be interested. Be sure to introduce them to the group and clarify their roles as outside observers and listeners. This should be covered in your preparation and introductory comments, and again, if anyone's uncomfortable, the observers should be asked to leave. And be sure your observers know in advance of that also that this is a possibility.
Oh my gosh, Denise, thank you so much for all of that extremely practical detail. I hope that listeners are getting a sense of the steps necessary to plan for and implement a successful and effective focus group. And so in closing here, what we want to ground you in the point of conducting focus groups or listening forums like this is to create change. And it's to be informed by those in our communities who are experiencing this type of violence in guiding and creating that change. But there are some things that you do before you get ready for that change, and primarily one of those is debriefing the focus group. So Denise had mentioned this already, that to build in some time overall for those who are involved in implementing the focus group, that they should have some time at the end not only to clean up, but to immediately debrief the discussion that came up during the focus group. So everyone involved should take at least a few moments after the group has concluded to debrief, including the planner, facilitator, note taker, observers, and the advocate, if the advocate isn't talking with one of the participants of the focus group. This conversation, while everything's fresh on people's minds, is really important to capture good quotes, make sure the note-taker captured important moments and themes, and to review what worked and what didn't work about the facilitation of the focus group, about people arriving, etc. All of that information, while it's fresh on everybody's minds, is really important to capture as quickly as possible. It's also an opportunity to identify any survivor participants that might need follow-up sooner rather than later by a community-based advocate, and to identify ways that survivors could stay in touch with other social justice activity in the community if they're interested in that. So it's an important time to build in overall to the focus group is that debriefing time immediately following the group. But then as soon as possible in the days after the group is concluded, the organizers should also meet to conduct a more formal analysis and debrief. You want to review the notes that were typed or the transcripts, and together ask yourselves, what key gaps did participants identify? What does this mean for our systems response, or what it is that we're looking at with developing our SART or advocating for some aspects of change within our systems response? What do we need to know more about? What did survivors bring up in the discussion that we were surprised by, and we need to learn more about what they had experienced? Who else might we need to talk to? Are there investigators that we need to talk to? Are there other advocates that we need to talk to in order to round out the themes and the things that were coming up in the discussion with the survivors? And then finally, with this more formal analysis or debrief, figure out who do we share this information with, and what are the next steps for sharing that information. So related to that then is some key tips on developing summaries of the focus group, more formal summary that you could share with others that weren't physically at the focus group. So the summary should include a description of the group, including the date, the time, the location, how many participants were there, the kind of the demographic makeup of the participants, any key themes, gaps, and or recommendations that came out of the focus group discussion. As Denise said, it's very powerful to include quotes, stories, very concrete experiences, but it's super important that those are not identifiable. Sometimes you'll need the help of an advocate in the community to know whether a certain aspects of a survivor's story would be recognizable to those you share the summary with. For example, I was working in a very rural community in northern Minnesota, and one victim's case had several really unique aspects to it that we needed to be very wordsmithing to ensure that that victim's identity would not be exposed in the summary that we were sharing with other practitioners. And that summary itself concretely is typically a document or a report, summary of themes, but sometimes communities have instead produced slideshows to share the information with others rather than, a 10-page report or summary. So then you also want to think strategically about who to share the information with. In this context, the first audience is likely to be your SART, but there might be some reasons that you don't want certain information you don't want to bring to a sort of a more public setting like that where there's multiple people, because there might have been something particularly sensitive or maybe egregious that a survivor described had happened to them when interacting with systems, and you want to really handle that information in a different way. You might instead decide to approach an individual practitioner or agency head or supervisor with the information that you learned and strategize with that person about how to address the concern that was raised in the focus group. But sometimes if there are themes that maybe are generally already known, but there's some concrete things, stories that you learned in the focus group that your SART is ready to hear and discuss, then your SART is likely to be your first audience. And then with your SART, your very closest partners in organizing responses to sexual assault, you want to strategize with them about who else needs to hear the information that was gathered. Is it an agency head? Is it a supervisor? Is it the mayor? Is it other advocacy groups, etc.? Again, if information that was raised during the focus group is potentially embarrassing or damaging to a particular agency, you might want to consider a private one-on-one meeting with the supervisor or a designated representative. And in that meeting, this is more about the how of this, you want to be sure to use an approach of constructive engagement and emphasize a joint problem-solving approach. And in that, it's really important to be as prepared as possible for that conversation, that it's very important to be well-informed about the nature of the problems identified, grounded in the lived experiences that you learned about through this focus group, but also reinforced by other information that you've gathered about responses in your community or maybe elsewhere across the country. You want to understand how the problem was produced or have some idea of that, and then really constructively engage with those agency heads about what can be done about the problem that was raised. And you really lean on your SART membership about when and how to provide the information to agency leaders and supervisors. It's critically important that they're your gateway to opening doors and creating buy-in for hearing the information and for leveraging change. If you've decided you want to share the information with a broader interagency team, like a policy setting group, something that isn't just your SART membership, but it's maybe a bigger interagency group like that, you want to consider how this will be done, whether this is in a public or a private setting, if you're going to summarize the themes in an interagency meeting, then you want to be especially cautious about how the gaps and themes are framed and ensure, of course, that nothing is identifiable as coming from a specific individual. And those are really important and nuanced conversations to have with advocates and with other practitioners, because you want to be so careful about protecting survivors' confidentiality and privacy. And so then what next? So this information is out there, and regardless of how the information from the group is presented and to whom you're presenting that information, you want to emphasize that the purpose is to facilitate problem solving. This is not about criticizing or blaming specific individuals or agencies. We recognize that the problems are not created by an individual worker or their lack of competence or empathy, but you're staying focused on work structures that don't take the survivor experiences into account. Use the information to help identify solutions to those problems, the structural problems. We're not trying to get people into trouble for poor practices. And there's a lot more information about this kind of what next conversation that's available on our website, but is more than we can get into at this moment. But that's the summary of sharing the information with practitioners about with whom and how you do that. And the other concluding point about focus groups that, of course, we want to emphasize is the importance of being prepared on the front and back end of the focus groups to be engaged, connected with, and supportive to survivors who participate. So during the group, before the group, while you're planning the group, as Denise suggested, the screening tools, disclosing all of the information about the potential benefits and risks to participating is vitally important. During the group, same thing, is that the survivors who participate in their stories that they're telling are vitally important to improving local institutional responses to sexual assault, reassuring that with them, that the information will be used for that. After the group, you really want to stay connected to provide support, reassurance, and advocacy. Some survivors may be talking to advocates for the first time when they come to the focus group and may not have known how advocates can be helpful. So for some survivors, just getting through daily life is a challenge, and for others, activism can be a pathway to justice and healing. And then for follow-up with survivor participants, you want to get back to participants and tell them concretely how the information they shared was used to improve the institutional response. You don't want them to go away into a black hole and never be in touch with them again, but you actually want to share back with them the changes that you've been recommending at the system level based on the information that they shared. Also, it's an awesome opportunity to invite survivor participants to participate in future actions to seek justice at the community level. Invite them to marches, to get out the vote activities, for public speaking engagements. Survivors can access healing and justice and meaning about the experiences that they had by being active in their communities. And finally, we can't overstate the experiences that facilitators, note takers, and observers have listening to survivors talk about their experiences. And so we encourage you, if you do have the opportunity, to organize a focus group like this or listen to one, participate in one. What did you learn that you never knew before about survivors' experiences? How did the survivors challenge your beliefs about what they want, need, or are ready for? Who decides what survivors want and need? And recognize that all survivors have different and unique needs and experiences, and do some personal reflection about what that means for your work moving forward. So in summary here, I wanted to just share a couple of very concrete examples of systems change that we have been a part of as a result of communities conducting focus groups with survivors. So in one community, they conducted focus groups with sexual assault survivors, and one of the survivors during the focus group reported that her veterinary doctor for her dog called to check on her dog after a pretty major surgery, but no one had followed up with her after she reported being raped. This was a huge aha moment for the community of their lack of structure to stay connected and engaged with survivors. And so really immediately upon hearing that information from the survivor, the SANE program structurally changed the way they were organized to follow up with survivors after they had reported being raped. In another community, they conducted a focus group with Native victims of sexual assault who reported a lack of engagement, not being believed or taken seriously by patrol officers when they were reporting rape. And so the resulting impact of that was a whole lot of things, but one concrete thing was that they developed specialized law enforcement training on engaging with Native victims when conducting investigations. In another community, they conducted focus groups with domestic violence survivors who reported not knowing when the offender was getting released from jail, and so they couldn't adequately plan for their safety. So a concrete structural change that resulted from that was that jailers were structured. One of their checklist items was to make meaningful contact with victims before an offender's release. And finally, focus group participants in another community of sexual assault survivors, and this is very common across the country, of course, reported not being believed throughout the criminal legal system processing of their case. The retelling of their story so many times, the way they were questioned, etc. And so in this one community, investigators began utilizing an interview process that included a belief-based approach, particularly with sexual assault survivors, that would recognize how and why a survivor's recall might change, and that inconsistency, changing story, or deception doesn't equal a false report. So very, very important concrete outcomes can result when you talk with survivors about how they're experiencing system responses. So we've got lots of resources on our website, and we're always happy to talk with people and guide people about thinking about how to use institutional analysis in their communities, and specifically focus groups and learning from survivors. And so we're highlighting some of those resources here, and they'll be available on our website until the end of time, and we'll continue to add more as well. With that, Christina, I think I'm passing this back to you or to Joe.
Hi, well, thank you so much for sharing all that information. It is excellent, and it is so appreciated and useful for folks. So I really appreciate that. I think we have this one last slide for you, and these are the ways to get in touch with the Praxis folks who have just plenty of information, as you heard, and can really answer any other questions that you have on the information you heard today. There's also more information in the SART Toolkit, and we'll have a slide with that information as well. And Joe, was there any contact information that you wanted to provide or anything else you wanted to add?
I really just want to be able to encourage people to look back to the SART Toolkit, because there are some important guidelines in there and considerations if you're doing these kinds of conversations or interviews with community members. Those community members may include survivors, their family or friends, and there's important things to consider as those folks may disclose more personal experiences of abuse and lots of forms of violence. So the importance of disclosing your own limits of confidentiality, listening with compassion, and addressing safety, all of those kinds of thoughts and really important elements have been described and are available in the SART Toolkit. So that's it for me.
Well, excellent. Thank you, Joe. And here's a couple ways to connect with NSCRC. We are a technical assistance provider to SARTs and to anybody serving victims. We have a fantastic library, and the toolkit link is here as well. So www.nscrc.org/SART Toolkit. And that is a searchable toolkit, so you'll be able to type in focus groups or listening forums or confidentiality and find a deep dive into that information as well. And I'd just like to say thank you so much to our presenters, especially thank you so much, and thanks for everybody who listens to this webinar and then implements these, the things that you learned here and the information that you gained from survivors. So we really like to thank you for all the work that you do all the time to support survivors, to listen, and to improve your services. Please, if you use these tools, please let us know. We always like to hear how they worked and be able to share that back with the rest of the field. And with that, we are going to conclude the webinar, and we really appreciate everyone's time, both presenters and folks listening in. Thank you so much.